ABC15 investigator Dave Biskobing and data guru Garrett Archer have been investigating hidden COVID-19 deaths for the past week, and they've uncovered data showing the true number of uncounted deaths could be significantly higher and started much earlier than the state's reported so far.
The data we're about to show you is public. It's not a secret. It's posted on the CDC's website. It's something our state leaders have access to. So with today's announcement that the health department is going back to try and figure out uncounted deaths, it all raises the question about whether or not they were paying enough attention. Up front, here are the facts. Deaths in Arizona this year are up a lot, much more than the number of known COVID-19 deaths. Where did you get the data from?
So this data is from the National Center for Health Statistics.
Garrett Archer is ABC15's data analyst, and outside experts like Dr. Sam Clark from Ohio State University, who studies disease spread, says it's the best source out there right now.
It is definitely the raw count of deaths is definitely the best metric we have.
Now back to total deaths, and so you know what you're looking at. What is the gray line?
The gray line is the 5-year average.
So the blue dotted line, that's this year.
Yeah, so the blue dotted line is this year.
In Arizona, total deaths are up 4% from last year. About 750 more lost lives.
That's dramatic. You know, it hardly ever happens.
I mean, it's fair to say a large percentage of that percentage increase is due to COVID-19.
Yeah, by the entire context that's created by COVID-19. So the direct deaths, the indirect deaths.
Some specific categories stand out where uncounted COVID-19 deaths are almost certainly hidden, like an increase in natural cause deaths, and this one. It literally jumps off the chart.
Yes, there's nothing to explain this chart except for a classification of COVID-19 deaths.
It's a category of deaths classified as symptoms, signs, and abnormal clinical and laboratory findings, not elsewhere categorized.
Sort of the catch-all that's being used. This is a category in which only 20, 30 deaths are assigned a week, if that. And the last several weeks, we've seen this explode into the hundreds.
171% above normal. Just 15 weeks into 2020, already close to reaching the average per year.
I mean, you're already way outside of the historical norm.
And look, the deaths here begin to spike in early February, weeks before our state thought it was dealing with COVID-19 outbreaks. There's nothing that generally jumps to mind that could easily help us understand why we're seeing this crazy spike in this category.
No. The only thing that jumps to mind is something like COVID-19.
We checked with some county medical examiners to see if there was some simple explanation, some new type of reclassification to account for the spike. We were told, no.
And the problem here is that our surveillance systems, as we know, are not set up to deal with COVID-19. We can't test everybody. If we could, a bunch of those deaths would probably wind up in the COVID-19 category.
Arizona's behind almost every state in testing, has been from the beginning.
What I would predict is going to happen is that category we're looking at right now is going to kind of come back down to what it was in the past. And if you do testing and so on, you're going to get a new COVID-19 category, which is basically going to suck up most of that.
Well, at the end of March, the CDC started calculating COVID and COVID probable deaths. That's this teal line. Now look at it compared to the huge spike in the catch-all death category we showed you before. It mirrors it, then meets it, basically taking over the numbers. It's strong data showing those could be hundreds of uncounted COVID-19 deaths, with a spike beginning back in February. I'm investigator Dave Biskobing, ABC15, Arizona.